You haven't gotten your flu shot yet. Doctors are saying that there is no time like the present. Here in Illinois, flu cases are up once again, and they're spiking up with hospitalizations included in those increasing numbers.
And right now, the state is once again at a high level of respiratory illness activity. NBC5's Jenn Schanz joining us live from downtown. And Jenn, you got some tips from a doctor.
That's right, Michelle and Evrod. Doctors are suggesting anyone 6 months of age or older should be getting their updated COVID-19 and flu vaccine. So if you haven't already done that, that's something they are strongly urging people to do. If you are experiencing symptoms, you should isolate or you can mask. Right now, while the state is experiencing a dip in COVID-19 and RSV cases, flu cases are on the rise, and they are affecting young people quite a bit right now. This is data from the state according to the week ending January 25th. And as the state is seeing less COVID and RSV cases, there were 3 times as many hospitalizations for the flu as for COVID that week. Almost 20% of ER visits were for acute respiratory illnesses, and that could include all 3 of those: COVID, the flu, and RSV. Taking a look at the state's dashboard for seasonal respiratory illnesses, you can see that those ages 5 to 17 are the most impacted by influenza A right now, compared to seniors being affected by COVID and infants and young children being most impacted by RSV. Here's Dr. Sharon Welbel with the Cook County Health Department.
Especially emergency department visits are quite high right now. It actually is higher in this last week than it was in the week prior.
Respiratory virus symptoms to watch for include fever, runny nose, sore throat, or a cough, in which case you should consider getting tested. And while pediatric deaths from the flu are rare, this season so far in Illinois, the state has already recorded 5. It has recorded 3 pediatric deaths from RSV and 1 pediatric death from a combination of RSV and COVID. Now, you might be wondering, how long does the flu season last? Well, generally it can stretch into the early spring. That's when traditionally you'll see the transition from influenza A to influenza B. So no time like the present to make sure you and your family are protected.